Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary Leblanc. On this episode of the podcast, I am speaking with Don Martin, Executive Director of the Regina Community Clinic, and Katherine Lyseiko, Program and Communication Coordinator of Regina Community Clinic, based in Regina, Saskatchewan. Regina Community Clinic provides a wide range of health and social services geared to the diverse needs of individuals, families, and groups in the Regina area. This episode of Community Matters will be centered around the work Regina Community Clinic has achieved through the PHAC-funded Project for the Community Vaccination Promotion, CVP-National project with CACHC. Don and Katherine, how are you both doing today?
We're doing well, thank you.
Very well, thank you.
Thank you. Thank you for being here. First off, I would like to ask you both to tell me more about your specific community health center, the main aspects of your organization, the communities you serve, and the services and programs that you guys provide.
Sure, we'll do our best, and then I'll throw it over to Kate a little bit. So we're one of 4 cooperative community health clinics in Saskatchewan. And we have a long history of providing integrated primary healthcare services in the Regina area. And I think, the cooperatives in Saskatchewan are really part of the fabric of life here in the province. And so we're really quite happy to be a part of that. And I think as part of that, we really saw reaching out to the community, providing community supports, strategic partnerships are really built into our strategy and what our board would like to see us do. So this seemed to flow pretty naturally, I think, into this kind of a grant project. And so we thought, we've got a lot of refugee folks that come through the clinic, who are, already struggling just to deal with, being displaced. And maybe we could, maybe we can help out with vaccinations and vaccine comfort if we did both English and then several different kinds of languages. So Kate's going to talk a little bit more about what we offer here at the clinic, and maybe just to give you a better idea of everything that we do have.
We have several programs and services that we offer patients and to the community as well. And our focus is preventative health care as well, not just dealing with people when they're ill, but also providing programs and services that are educational, that help people maintain a healthy lifestyle. So we have 9 primary healthcare physicians and 1 who participates in obstetric rotations. We have 2 nurse practitioners as well, and 1 deals with chronic disease management, and the other oversees the refugee care. We have laboratory services, x-ray services, we have a medical records department, counseling services, we have exercise therapy, an exercise therapist, as well as a gym, a nutritionist, and we also have in Regina the Fetal Alcohol Spectrum Disorder Center as well, and we're a resource. We provide that resource for members in southern Saskatchewan, and we're working with the FASD Center in Saskatoon as well. We work collaboratively with the Regina Open Door Society and Catholic Family Services with refugee care, and we provide primary health care to refugee patients and possibly expanding to other care as well. We also have pharmacy services that aren't part of the clinic, but they're affiliated with the clinic as well. So that's provides services, this type of service to our patients and members. And we have other programs such as positive body image programs called Craving Change, Be Body Positive. We have smoking cessation, weight management. We're looking at music therapy. We provide foot care services as well. And we're looking at other classes for self-empowerment and maintaining health, maybe for seniors as well.
What a list. That's impressive. So Katherine, I'll stick with you and ask you this question to start off. What has the impact of the pandemic been to the community that you serve?
The impact of the pandemic in our community, I suppose it's COVID fatigue in the general population has affected our community, has affected all of us, as well as our staff, as well, medical providers. And it's been a way we've had to find ways of adapting to provide services at this time.
Mm-hmm. Mm-hmm.
Dawn, did you want to continue? Any other feelings about how the pandemic has affected the community?
Yeah, I think our community, I think people are just really tired of the massive amount of information that they're being forced to process, on a weekly basis. And it's almost a giving up. I think, it's like, what, I just can't process one more bit of public health information and public health order. And, one of the frustrating things for us recently has been the lack of information. So we're trying to navigate, policy development and how we run the clinic with not having full details around what the pandemic is currently doing in Saskatchewan. So that's been a bit trying. And like every other healthcare organization everywhere, we're trying to predict a little bit about what's the future going to look like after this pandemic, right? Whatever that happens to be. And there's no certainties. And so it really it feels like we're just in this constant state of preparedness, and you can only sustain that for so long before you start to fatigue, right? So we're just trying to, do the best that we can with the information we have, but it is challenging, I think, on a system basis as well. And so I think, we're dealing with all of those elements. We're dealing with patients, we're dealing with our health providers that are tired, and we're dealing with a system that's kind of running out of energy here as well, like everywhere else.
Yes, exactly. And so on that note, Dawn, I'm curious if you could tell us about the CVP-National project that was funded by PHAC through Canadian Association of Community Health Centers, and why it was important that you engaged with your community in this way.
Yeah, absolutely. I'll probably throw it over to Kate for most of this, but from my perspective, because of the services that we provide, and because in particular our vulnerable population of refugee folks coming in, we just thought that it was a natural link to be able to take advantage of the funding that was offered through the grant program with CVP and PHAC. And CACHC, of course, but our goal really is, what can we provide for our community, and how do we do that? And because we're a cooperative, we have certain benefits as well, and connections that other organizations may not have. So we want to I think for us, we felt like we really wanted to do our part in making sure that we had tools and resources that were targeted specifically to our client base, our providers, but also the refugees coming through our doors. But we did offer that up to our other partners, the Regina Open Door Society, Catholic Family Services, and we also shared our resources with a couple of other cooperative health clinics here in Saskatchewan. And to us, that's really what we're doing is just, if we can avail ourselves of certain things and we're able to create some tools and resources, we want to make sure we push those out as far as possible to have them utilized. Kate, maybe you want to jump into something more specific on that.
We consulted with the settlement agencies as well as our physicians with what might be helpful. And so we created social media posts and printed materials, such as posters and brochures that are easily given to patients if they don't have access to electronic information about vaccines, general vaccines, and the COVID vaccine. And we focused on specific information such as what is COVID-19, explaining what this virus is and its effects, COVID vaccines, general vaccines, vaccine safety, vaccine misinformation, and how to find reliable sources, rather than, because there's so much out there in social media and electronic news that's false, that it's these conspiracy theories that are generating more fear amongst especially our vulnerable population, that they're already displaced and suffering from trauma, and they're hearing these other things that are quite upsetting, which are not true. So this was a way of helping create this information so they're informed and less fearful. We translated from English. We have translators at or interpreters here at the clinic. And we have interpreters that did the translations into Arabic, Pashto, Dari, Burmese, and Tigrinya. So those were the languages that these materials were translated into. And we also, our physicians were also concerned about communicating with their patients, because they were inundated with a lot of vaccine hesitancy and questions about the vaccine and the information they were acquiring from social media as well. And so they were looking for specific type of information that would complement the information that's already on the Saskatchewan Medical Association website, as well as the Canadian Medical Association, about vaccines, the COVID vaccine in particular, but general vaccines. So we created a guide based on motivational interviewing, which is a way of evoking a conversation with the patient rather than having where the patient feels they're being defensive, or they're made to feel they're being spoken to rather than having a conversation. So this is a technique that's particularly helpful in engaging the patient and being an active participant in the conversation and about the information. In the guide as well, we included a questionnaire about these specific issues for hesitancy, anything from just being fear of needles to thinking they might be microchipped with a vaccine. So we've had quite a range, and this way the practitioner can ask the client, or the settlement officer can ask, well, what is it specifically? And they can address those specific questions with information that can help alleviate that fear and that misconception.
Amazing. I've seen the resources and they're absolutely lovely. And of course, everyone wants to feel that they're a part of their own health and their own medical journey. And so it's so important to make sure you're meeting people where they're at in the language that they speak, and speaking with them about it and educating them about it, and not telling them what to do about vaccination and the pandemic, which I think is where a lot of people have been butting heads. So it's crucial work that you're doing, and it's so important. I'm curious, how has the reception been for these materials? Have you gotten any feedback yet, or seen them in use, or has anyone given any feedback on how they've been received?
We need more follow-up from our affiliated agencies with the settlement agencies, but our physicians and nurse practitioners and other medical caregivers here, or professionals, have been very happy. It's been well received in the clinic, the pamphlets as well as the guide. And they distribute, especially with the refugee clients, they will pass on the brochures and the pamphlets to them, and it's been useful.
Wonderful. Dawn, I'll ask you, with the lifting of the vaccine and mask measures, how does your clinic plan to continue to promote and encourage the uptake of the COVID-19 vaccine as well as vaccines in general?
Yeah, absolutely. We here, because we're a medical clinic, we've not actually lifted our mask mandate. I don't see us doing that in the short term. And we certainly expect all of our staff to be fully vaccinated and continue to encourage and educate, I think, on the importance of not just COVID, although that's top of mind, but other vaccinations,
Yes.
childhood and flu. We do a flu clinic every year. We try to work with the providers, and the providers are working with their patients to make sure that they're getting necessary vaccines. I think we've got a little bit of leftover, not a little bit, we've got quite a bit of leftover funding. So we're hoping, working with CACHC, that we would look into perhaps some Indigenous language brochures, child vaccinations, just general support and education where we think we need it. And we still have to sort of work out all the details, but we will. We're already investing in equipment for vaccine storage. That was happening anyways. We're hoping to offer more vaccines, I think, into the future here at the clinic, just to be, more of a patient hub on that front as well. And again, to Kate's point around preventive healthcare and just making sure that, especially adult vaccinations too, I think, even speaking from personal experience, you sort of forget what you might need. And so we want to make sure that people are aware of what's important and, how often you should be getting some general vaccines to protect yourself so you don't end up in a merge or, at the clinic sometimes too with preventable things. So yeah, definitely looking to promote that more.
What needs do you see within your community that rely on investments from both provincial and federal governments and health system decision makers to improve the health and well-being of your clients and community? Katherine, if you wanted to go first.
I'll go first, and then Dawn can elaborate. The resources within our clinic to provide more mental health care to our patients and our refugee patients, and perhaps resources to help those suffering and recovering from long COVID, even though that's a sort of a new phenomenon where maybe that's something that we might be looking at with that type of funding and partnership.
Mm-hmm. Yeah, I think the only thing that I would add is in my I've been here less than a year, but I've been coming as a patient to this clinic for over 30 years. To my way of thinking, the recognition of community-based cooperative healthcare organizations and that very integrated provision of healthcare services hasn't been recognized as fully as it should be in terms of the model that we provide. We keep building other models, and this I know this because I've worked in the health system for a long time. We keep saying, oh, we're going to have this new primary health care model. Oh, we're now going to have a patient medical care home, and we're going to do this. Well, community healthcare cooperatives have been doing that for 60 years now. And we haven't been really good at tooting our own horns in relation to that. But I would really like to see in partnership and complementary to the other models, some real focused and structured work on sustaining and enhancing and a growth agenda related to the cooperative community health centers, and how they can work side by side and in the system without losing their uniqueness. Because sometimes I find our health system anyways doesn't quite know what to do with us. They keep trying to package us into these little networks, but we cover a large area of Regina and area, and we don't fit into their network. So they're really, we still need to overcome some of that so that we can really complement and continue to provide services. But we could also help, right? We could also take on some strategic areas just based on our location or based on what we already offer. And it's not there yet. And I think that would be really helpful, both. And I think from a federal government, it's less federal, more provincial, but, we could look at First Nation services, Indigenous services, that kind of thing as well. And really building a robust offering for a lot of folks in this area.
100%. What do you think your experiences at Regina Community Clinic over the course of the pandemic say about the ability of community health centers to adapt to emerging social and public health issues and the importance of CHCs within our health and social service systems? Dawn, if you wanted to start.
Yeah, I think we've kind of touched on some of that
Yes.
already, but I really think that the really great thing about community health centers like ours across Canada is that, we are constantly adapting to kind of meet patient needs and community needs and what's going on in the environment. We're really quite adept at that. And we have, because of our uniqueness and some of the standalone that we have more flexibility possibly than the larger health system in many ways. And I think we can move quicker and be more responsive to the environment and to what's going on. And I think, that in and of itself just, makes us unique and uniquely positioned, I think, to address a lot of things and to be, one of those great partners in healthcare. Yes. I don't know if you had anything else to add to that, Kate, or?
No,
Yeah, that's what I think anyways, Hillary. Yeah.
Very well said. I mean, we ask that question of all of our guests and we always get the answer that CHCs do something that not a lot of other places do. And they're so crucial to giving more access to primary healthcare and all of these different niches to bigger communities. And they're so important. I want to thank you not only for the resources that you built and for being part of the CVP project, but for taking the time to speak with me today, both of you, Katherine and Dawn. My one last question is always, if anyone was looking for more information on Regina Community Clinic, where could they go and find out how to access some of these resources?
They can look at our website. It's www.reginacommunityclinic.ca. We will be putting some of the resources on the website, as well as we have Facebook, Regina Community Clinic, and Instagram, Regina Community Clinic.
That's perfect
as well.
And I believe the resources will also be in our Rio Mix hub that is
Yes.
launching shortly after this episode launches, I believe. So very exciting for us on our side and for you guys as well. So Dawn, Katherine, I want to thank you both for your time today.
Thank you.
Thank you.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.